Hello everyone. Welcome back to a new quick review. We are going to talk about today to a high GI topic related to the step 1 and to the step 2 CK as well. This is an anatomic part of the GI tract to the gut. When we are talking about the GI tract, we need to be sure that we are able to identify in which part of the tract some components are going to be absorbed. So first of all, we need to try to recognize the anatomic part of the GI. This is the esophagus, and the esophagus is going to be attached to the stomach, and the stomach is going to be attached to the duodenum. And after that, we are going to get many curves. And at the end, we are going to see the colon. Now, the most important part of this draw is the duodenum. In the duodenum, we are going to absorb some things that is important for our test. That components are the folates, that is the vitamin B9, the iron, the carbs, and the calcium. If for any reason we got any problem in the duodenum, that is this part, we are going to get some problems with the absorption of these components, the folates, the iron, the carbs, and the calcium. If we are not able to absorb in the correct way those components, we are going to get some expression in our body. So if we are going to get a deficiency of these components, we are going to see some symptoms in the patient. When we have low levels of B9 or folates, we are going to get a megaloblastic anemia. Megaloblastic anemia. When we got low levels of iron, we are going to get a microcytic anemia. When we got low levels of carbs, we are going to decrease the weight. We are going to lose weight. So low levels of carbs is going to show us in the patient a decrease in the weight. And low levels of calcium is going to show us in the patient osteoporosis. Now, another important components that we need to absorb in the GI tract is in the terminal ileum. In the terminal ileum is going to absorb the B12, the vitamin B12, the fat, and the fat vitamins. The fat vitamins, the A, D, E, K. So if we are going to get a decreased levels of absorption in the vitamin B12, we are going to see in the patient a macrocytic anemia, a megaloblastic anemia. If we are going to decrease the absorption of the fat vitamins, we are going to get different situation in that patient. So decreased levels in the vitamin A is going to show us a night blindness. Low levels of vitamin D, because we are getting any problem in the terminal ileum, that is decreasing the absorption of vitamin A, D, E, and K, The vitamin D, when the vitamin D is decreasing the absorption, is going to show us osteoporosis, because in the normal situation, the vitamin D increase the absorption of calcium. As we are going to get decrease in the absorption of calcium, that is producing increase the reabsorption of calcium from the bone, so produce osteoporosis. And the another point is that the vitamin E. The vitamin E is an protector from the free radicals against of the red blood cells. So when the free radicals try to attack the red blood cells, the vitamin E produces a protection around of the red blood cells. When we decrease the vitamin E, the red blood cells are not able to get a protection against the free radicals, and that produce hemolytic anemia. And the vitamin K is a great factor for the 10, 9, 7, and 2 factor of the coagulation cascade. Those factors, without the vitamin K, they are not able to work in a perfect way. So we are going to get up bleeding problems. And with this quick review, I try to show you the components that the tests can be show us during the test. So try to be sure to identify the folates, the iron, the carbs, the calcium, the vitamin 9, that is the folate, the vitamin 12, B12, the fat, and the fat vitamins. With this quick review, we're finishing today. I hope that everything tried to learn about this. Take care, and I see you next time.